I had osteoporosis, just lots of things. And so we had a really good visit, and he said, now you understand, this is a long surgery, it's a difficult surgery, and when you get done with it, you're not going to be able to do hardly anything. But, of course, therapy is going to get you going again. You get to make the decision if you want the surgery or not. And I said, well, of course I do. He said, if you don't, I will tell you this. Within 2 years, you'll be in a wheelchair and you'll never get out again. That it will be what you'll have to deal with.
Anderson was a very active individual prior to her back surgery. She even participated in running races with her friends and family, but had to stop due to the invasive pain she began to experience.
What you need to do before you come for surgery is you need to make a spot in the nursing home that you would like when you get out of the hospital, and so that they are ready for you, because that's where you'll need to be first. I started out not able to walk, and so they took me by wheelchair to the therapy room. And eventually, one day, I got to walk with the walker, which was exciting. I know that sounds kind of crazy, but those days were very important days. And sometimes Leroy remembered that one of them said, when I was sitting in the room, today you're going to walk to the bathroom. And I said, oh, I don't think so. I can't walk yet. Oh, yes, you're going to. And that's how they kind of approach things, But they were all just excellent. I can remember the occupational therapist took me to a dishwasher, and I had to unload the dishwasher. I mean, just things that we knew that eventually I was going to need to do.
During Anderson's time in rehab, she transitioned from a wheelchair to a walker in just 2 weeks. After completing rehab, she continued to work out in her basement gym to stay active.
And I did exercising. I had a personal trainer for 2 years before I had the surgery. At that time I started it, I didn't know for sure I was going to have surgery, but anyway, that they just made sure that when I was exercising, that I was doing it the right way without hurting anything. But he said, if you hadn't have done that, you probably would have gone down long before that. So that was true. I kept things moving, and that was better for me. When somebody advises that you need it, you probably need to do it. I mean, I know I could have said no, but I'd be in a wheelchair today and not be able to do hardly anything by myself. Don't refuse therapy, because that's what picks you up and gets you out of the surgery so that you can do what you've always done.